All right, guys, in this video, I'm going to be going over the bottom surgery guide that I created in depth. Back in 2021, I had RFF Phalloplasty with Dr. Mang Chen and Dr. Andrew Watt with the Buncke Clinic. This is all based off of my own personal experience, so please just make sure that if you do decide to go with Dr. Chen, do your research because some things might be updated. Okay. Now, this bottom surgery guide is available for free download. It's a PDF. You can find it in the link in my bio. Just head to my link tree. All right, first things first, do your research. Choosing your surgeon is extremely important. This surgery is not something to just go pick any surgeon just so that you can get it as fast as possible. This is a very complicated surgery. Most surgeons do this in 3 stages. For me, I went through a bunch of Facebook groups. I went through Bucket, but I'm not sure that that's available anymore. I had heard so many good reviews about Dr. Chen, so I went to his website and I looked through all of his results, both on the website and also on other websites like Bucket. I really liked his results. They're very realistic. He's getting better and better. And I made sure to compare all of his success rates, all of his complication rates to other surgeons. Once you've decided on your surgeon, you're gonna wanna make sure that they take your insurance. And then once you're all covered on that, go ahead and schedule your consult. Some surgeons have wait lists that can be a year plus long, so get your consult scheduled ASAP. In person is always best if you can. For me, my consult was virtual over a Zoom call or telehealth, one of those. And then make a list of any and all questions that you have for your surgeon. There is no such thing as a dumb question. Trust me, if you don't ask, you're going to regret it later. All right, the next thing is choosing your donor site. Your surgeon's gonna help you choose your donor site. For me, I originally wanted to go with my thigh because I didn't want an arm scar, but my surgeon and I, we did a pinch test on my thigh and I had too much fat to go with my thigh. Otherwise, my girth would have been, he said, the circumference of a Coke can. That's just not the size that I wanted, so we went with the arm. Definitely do your research too before you choose the donor site, just because there are pros and cons with going with each donor site. Generally, if you go with your arm, you are more likely to have better and fuller sensation. It's more aesthetically pleasing, it's more realistic when it comes to size and appearance. Just gonna be real with y'all. However, I have seen over the past 2 years that there are guys who go with their thigh and they're perfectly happy with their results. So again, this varies from person to person, so definitely work with your surgeon to make sure that you have the results that are closest to what you want. And then your surgeon should give you a hair removal template. I know Dr. Chen has one up on his website and it shows you exactly where on your arm you need to get your hair removal. The next step is your insurance. You need to get a prior authorization and you need to do that as soon as possible because that can also take a bit of time. There's a lot of parts that you have to get approved. There's a lot of different things because Dr. Chen does a bunch of different procedures in stage 1, and you have to get each and every one of those approved by your insurance. So once you know which donor site you're going with, you need to prep it. So you're going to need to do permanent hair removal, which is basically electrolysis. You need to start this at least a year before your surgery date. If you've never heard of electrolysis, they basically go into each hair follicle and they zap it. And they have to do this until you've completed the full hair cycle because there's a new hair that's gonna come out and then that needs to be zapped. And they do this until no more hair comes through. And that takes about a year. It's very important to clear all the hair on your donor site, especially the section where the urethra is going to be harvested, which is right here. Now, if there are residual hairs after surgery, you can go back and get electrolysis on your phallus. You just have to wait until at least 3 months post-op. I had a few left over, so I did have to go get it zapped. It was very painful, actually. But it was kind of like a good and bad thing because it was like, yes, it hurts, but like Yes, it hurts. I can feel that. And then with your arm being prepped, make sure that you protect it from the sun. So wear sunscreen anytime you go out. I also recommend wearing a sleeve to cover your arm. I got these long, stretchy compression sleeves. They're kind of loose, actually, so they're very comfortable. And then I got this sleeve as well, and it's a little bit more tight, and it covers the forearm scar kind of perfectly, the whole area where the graft is going to be taken. So I highly recommend these. These are also in the supply list, and there will be a link available. All right, the next step is you need to get 2 surgical readiness letters for gender affirming surgery. These are generally 2 mental health professionals. I got a letter from my therapist, who is a psychologist, and I got my second letter from my doctor, who prescribes my HRT. Next, save money. You'll need to save money for your time off of work, for your whole recovery, for all the supplies that you're gonna need, your hospital bills, etc. Now, after each stage, you should be able to return to normal everyday activities after 10 to 12 weeks, barring any complications, of course. Like I said, you're gonna have to save for your deductibles, your co-pays, your hospital and surgeon fees, prescriptions, travel and accommodations. Next, you're going to need to figure out housing while you recover. I was told that I needed to stay within 20 miles of my surgeon for the first 10 days. You need to stay close in case of any complications and also for your post-op appointments. I'm telling you, sitting in the car after bottom surgery is absolute torture, so try to stay as close as possible. All right, this next step I highly recommend when it comes to any surgeries: hit the gym. You need to strengthen your abs, your back, and your legs. It is going to be very difficult to get up and walk for the first 1 to 2 weeks. Surgery really takes a lot out of you. This surgery especially. So train your body. Next, meal prep. The first month of recovery, you're gonna be resting as much as possible. You're not gonna wanna move. You're not even gonna wanna get up to go to the bathroom. Like, you are going to want to rest. So make sure that you have meals that are already prepped and ready. But honestly, a huge thing is having a caregiver who can cook for you or have meals ready for you. Seriously, you can't even use your hand. Like, my left arm, my left hand it was all put in a cast, and I had absolutely like no function. I could barely even move my fingers in my left hand. You're not gonna be able to carry things. You're only gonna have one hand to use for a while. And it's really hard to open things with one hand. So the caregiver is huge, which is the next step, making sure that you have a caregiver or 2 or 3 or more. And you need to let them know exactly what they're going to need to help you out with. Caregivers can get burnt out really quickly, so it's important that they know exactly what to expect. Just so you know, and so they know, you're going to need help getting up off the couch, getting dressed, showering. Definitely need help showering, because you're also going to need them to support your phallus while you're in the shower. Going to the bathroom, pulling your pants down for you, helping you wipe, emptying your catheter bag, changing your dressings, doing laundry, prepping meals, making sure that you're taking your medication properly, and transportation. And honestly, there could be a few more things, but that's pretty much the basics. Make sure that you have coordinated transportation to and from your surgery, and also to and from your post-op appointments. Make sure that you have things to read, to watch when you're able to, because you're gonna be nauseous for a little bit. But have things that can distract you from the pain, and also when the depression, the post-op depression hits. A support system is so important. You really need to have friends who can be there for you, who can give you that emotional support. I highly recommend watching reality TV. It totally distracts you from the pain and the boredom. Next, prep your home or wherever you're gonna be recovering. I highly, highly, highly recommend sleeping in a recliner. I got really lucky and was able to sleep in an electric recliner for the first week when I was out of the hospital. And I had to press a button and it would just push me up and then I could stand up. So it was super, super easy. And then it would recline down for me as well. So if you can sleep in a recliner, do that. It's gonna make your life so much easier. Keep items that you're going to be accessing regularly close to you and off of the floor. And get yourself a lot of pillows. I wish someone would have told me this before, but your legs, your back, your arms, everything, your whole body is gonna need support. You're gonna need a lot of pillows. You're also going to need to get a bunch of supplies. Again, all of these supplies are listed in my bottom surgery guide, but I'll just quickly kind of go over them so you get an idea. I have the list here. So you'll need HIPAA-Cleanse, which is a body kind of disinfectant. It's very, very, very strong, and you'll use that in the shower before, typically the night before or the morning of your surgery. Magnesium citrate for your bowel prep, Miralax, Coleus stool softener, Neosporin, ibuprofen, Tylenol, Aquaphor. I'm telling you now, load up on Aquaphor. It was my best friend when it came to recovery. Medication logbook, very important. Thin stretchy gauze, a waterproof arm cover for when you're in the shower. Trust me, it will make your life so much easier. Disposable absorbent pads. I put those basically on the bed to keep my bed protected. Ace bandages for wrapping your arm. Foaming Dove sensitive skin soap. The foaming soap is very gentle. That's what you're gonna wanna use. Rubbing alcohol. Zero form, this is gonna be on your grafts already, but you're gonna want extra. A black towel to lay on your bed in case there's blood or any kind of leaks. A hair dryer for surgical sites after showers. That's the easiest and safest way to dry your incisions instead of padding it with gauze or a towel. Flushable wipes, boxer briefs that you can throw away later, Q-tips, cotton balls, a large hand mirror. That's so that you can see different angles. Very, very important. Disposable gloves and lots of washcloths because you're gonna need a lot of stuff for propping up your phallus and keeping it elevated. Now these things aren't necessary, but I promise you they will make your life so much easier. A honeycomb gel cushion, because sitting is going to hurt for a while. And I took that thing with me everywhere. Oversized sweatpants or shorts, oversized or loose shirts and tank tops, a bathrobe, things that you can just easily throw on. Slip-on shoes. I highly recommend Kizik step-in shoes. An extendable grabber tool, a travel bidet, a back scratcher, a shower chair, an adjustable neck pillow for your arm. I got one that I could use basically for my neck and my arm. It's adjustable. And a phone holder that clamps to the table because you're not gonna be holding your phone and then trying to do things with one hand. Trust me, get one of these. And then I have a list of supplies that you'll need once you hit 6 to 7 weeks post-op. This is when your incisions on your arm should be closed. I used Sika Care silicone gel sheets. They're clear. And I put them on my arm, and I also put them on the underside of my phallus. And then you should already have these, but the compression sleeves, I got a tighter one of these so that I could have the silicone sheeting pressed up against my scar to help it flatten. And then I got a looser one for just when I'm out and about, out in the sun, and I just want to protect my arm, but I'm not trying to do compression. These compression sleeves work really well also, and they're longer, and they're very comfortable. This is a Tattoo X sleeve, by the way. All these links I will include, trust me. And then once you're cleared to use these, I highly recommend Bio Oil. It's really good at dissolving stitches and also smoothing your scars. Jergens Ultra Healing Lotion. I put that on my arm. Also Palmer's Cocoa Butter for stretch marks. That's really good. Vitamin E oil. I really like Jason vitamin E oil. And sunscreen. You should wear sunscreen every time you go out. Now don't be afraid to ask the hospital for supplies. They will give you tons of supplies for free. I asked for Curlix gauze rolls, 4x4 gauze pads, alcohol wipes, a catheter stat lock, mesh underwear, a suture removal kit, tape, antibacterial ointment, more zero form, And bladder spasm meds. They will give you some, but you might need more. The bladder spasms are terrible. They're the worst. And then these are not necessary, but they can aid in healing. I got these. L-glutamine for reducing healing time. Arnica montana for bruising, swelling, inflammation. They're just these little pellets you take. Grapeseed extract for swelling, scarring, and it helps vitamin C get into your cells. Vitamin C, zinc, bromelain, that's good for swelling and bruising. L-arginine for immune function. And med honey, which is amazing at healing wounds and fistulas. And then you can get these dual pouch boxers that I really like post-op. Separatic boxer briefs. Those are the best post-op boxers in my opinion. There's also sheath boxer briefs and Saks boxer briefs. I like how they have these different pouches for everything because it keeps everything separate. You'll stay dry, you'll smell fresh, and you won't chafe. All of this is in my bottom surgery guide. Just head to the link in my bio. I'll also include it in the description, but just head to my link tree. There's also a direct link that takes you right to all of the supplies that I recommended. And these are products that I've actually used and I stand by. This next step, just be prepared. My surgeon told me to stop taking HRT 2 weeks before surgery and to refrain for 2 weeks after surgery. So basically you're gonna be off of your hormones for 4 weeks. So be prepared for that. And then the day before surgery, you're going to be doing bowel prep. Yeah, you'll be on the toilet pretty much the whole day before surgery. But trust me, you're gonna wanna be empty post-op. And they'll make sure to tell you what to get for that. I will be going over an in-depth timeline and what to expect post-op in another video. I hope this was helpful. I really hope that this helps you guys feel more prepared for your own bottom surgery, gender-affirming surgery. I know it sounds like a lot. I know it's scary. It is scary. But for me personally, it was 100% worth it. Even going through the complications, which that's another video, there will be complications, just expect that. But when you have a competent surgeon, that really makes all the difference. And I'm very happy with my results and what I'm able to do now. And I don't have any bottom dysphoria anymore. And that's the biggest thing for me. So, all right, I will see you guys in the next video.